Okay, going indirect, especially passively, the thing that is nice for me to have seen while you guys are working is that the thing that was requested was work on rotation. So the rotation, the amount of rotation was larger than it would need to be because of the frame that I put it in. So for me to see that gives me the opportunity to say, hey, if I'm asking for indirect, in almost all cases, it's going to be small movements regardless of plane. Okay, it's almost always going to be small movements because you're just looking to make the soft tissue soft with whatever combination of movements make it soft. However, if I ask you to work more in rotation, that's going to be the dominant thing. So the normal response early for most seems to be a larger movement. So thank you for letting me see that and reflect on that so that I can then say, anytime you're doing indirect, it's probably going to be small. Is it always going to be small? No. But it probably is, more likely than not. Okay, so I'm going to work on rotation in seated as my primary, and then layer in a bunch of concepts. I prefer to use the concept patient active versus patient passive. If I start passive and I'm going indirect, we're in the realm of LASBLT, in the realm of facilitated positional release. With respect to not finding a tender point, we are not in strain counter strain. We are not. But if I found a tender point, then going passive is strain counter strain. But I have to find that tender point first for it to fall under that bracket. If I go active first, it is functional technique. If I actively have them move to soften and then I add passive, it's functional technique. Those umbrellas help because if you're asked about it in other conversations, you can speak to that. However, how you do it is not any of that. How you do it is pay attention to the one in front of you. Okay? Always. If you try passive and passive doesn't work to start, what do? You do active. If you try active to start and it doesn't work, you do passive first. Then you see if you can layer. Okay? So it ends up looking something like this. It looks nothing different aside from magnitude than if I were to do seated rotation direct. Like this is not different because it's the same hold, the same movements. The aim is different. My target is different. Cross your arms. Thank you. Thank you for listening to that. So I'm going to go this way. I guess this isn't it for, like, there's no assessment. No, you're fine. Don't do that. I'm good. Keep your arms crossed. What? I didn't. Cross your arms. Oh, they're crossed. Okay. Cross them higher. Put them on your shoulders. Thank you. I prefer hands on shoulders because I am unlikely to hit sensitive areas and I don't have to try to not hit them. If the hands are on the elbows, you can hit sensitive areas on anybody on the front side of their thorax, and they often won't tell you in the moment because when that happens to you and you're uncomfortable with it, you're probably too uncomfortable to say it. So I like this better in almost all situations. Okay, so the rotation, so I'm going to work on softening the right side. I could try to soften both sides. You won't see it, but I would put my hand facing downwards, so it would be best in the lumbar. My hand would be facing downwards and spread on both sides, so I can palpate both sides. If I'm just focusing on the right side, my hand is going to be like that. Okay, so I'm just going to focus on the right side. I'm going to make it soft. Okay, I lied. My hand's going down. It's about fit. So I would prefer it to be this way, but wrong size. Just mismatch, right? So here, okay, I'm just going to make the right side soft. So I'm going to start it in rotation, okay? So I'm going to go this way. It doesn't soften when I go that way, right? So I'm kind of low lumbar here. It starts to soften this way, okay? That's all. If it starts to soften, I'm good. Now I'll add other planes. So she softened when I side bent to the right. Now if I side bend to the left, it stays softened. So it's not having much impact. Do you agree with that?
Yes.
Okay. But if I do a little bit more of the rotation and pull you back into me, everything softens more. You agree with that?
Yes.
Okay. If I do that, it gets tighter, right?
Mm-hmm.
So what I did is I basically leaned into her, and it creates relative extension, but the relative flexion and rotation work. Okay. Now, if I want to add to it active, even though this most Indirect approaches do not use active after you find the soft point. You can do it, it's okay, right? Because you're trying to treat the person. So what I'm going to try to do is I want you to push your right leg down gently and let it go. Left leg, let it go. Yeah, try to turn lightly to the left. Let it go. Okay. Now, when she let go, that softened nicely, but it didn't really have the net effect I want. And turn lightly to the right and let it go. And interestingly, when you turned to the right, it didn't get tighter. You agree?
Yes.
And when you were done, it felt softer, correct?
Yes.
Okay. It's not to be expected because I'm actually asking her to contract the stuff on the right, and it's not tightening up. That's why you have to check. Okay, so turn to the right again. Let it go. Right. And again. Good. There you go. And that's what it looks like. So it's, yeah, let your arms down. Otherwise, I start to feel weird. So you still have to check. So if you have a framework of things in an orderly fashion to check between, you have a target, you can follow it, you can know what worked and what didn't work. Whereas if you just have, okay, it's rotated right, I'm rotating it left, right? Or like, she likes rotating right, it's indirect, I'm rotating right. It's like, yeah, but what if it doesn't work? You won't notice it. You're less likely to notice it.